In the previous video, we completed amphenicols, which include chloramphenicol, thiamphenicol, and chlorphenicol. They are broad-spectrum antibiotics. They act by binding 50S ribosomal subunit. Thiampanicols are the semisynthetic derivative of chloramphenicol, and chlorphenicol are the fluorinated derivative of thiampanicols. Presence of para-nitro group in the chloramphenicol leads to the irreversible suppression of bone marrow, which eventually leads to aplastic anemia. This is about our previous video, that is amphenicol. Now in this video we will discuss quinolones. They are narrow spectrum. Generally they are narrow spectrum. Their activity is against Enterobacteriaceae bacteria and also gram-positive aerobes. Nalidixic acid is the first drug which is discovered by George Lister in the year of 1962 in the quinolones, and this nalidixic acid is later renamed as quinolone, and the fluorination of this nalidixic acid leads to fluoroquinolones. Now let us come to their classification. They are classified as first generation quinolones and second generation quinolones. Nalidixic acid and oxalinic acid are the examples for the first generation quinolones, and enrofloxacin and ciprofloxacin are the examples for the second generation quinolones. Now let us come to the mechanism of action of these quinolones. In the bacteria, there is an enzyme called as DNA gyrase, which is responsible to control the supercoiling of the bacterial DNA, which converts the covalently closed circular DNA to superhelical form, and it acts by energy dependent process and breakaging and resealing of the strands. Thereby, it helps in the transcription and translation of the bacterial DNA. And these quinolones act by binding the DNA gyrase. And specifically, DNA gyrase contain two sites, A site and B site. A site is the responsible to strand cutting, that is DNA strands cutting, and B unit or B site is responsible to ATP hydrolysis. These quinolones binds to the primarily a site of the DNA gyrase, thereby inhibiting the bacterial DNA gyrase, eventually leads to the inhibition of transcription and translation. In pharmacokinetics, aflatoxin is the unchanged form which is not metabolized to other forms, and as such it is excreted. And partially metabolized drug is ciprofloxacin, and completely metabolized drug is pefafloxacin. Now let us come to the drug interactions. Whenever these quinolones are combined with the beta-lactam, aminoglycosides and macrolides, they act as the additive effect, and these quinolones are enzyme inhibitors, thereby they decreases or inhibit the metabolism of other drugs such as theophylline and warfarin, and they form complexes with the metallic ions such as ions, magnesium ions and calcium ions. And now let us come to their administration. In the monogastric animals, they are administered via oral route, and parenteral route is preferred in ruminants. And the dose for the enrofloxacin is ranged between the 2.5 to 5 mg per kg body weight. Now let us come to their clinical uses. In case of veterinary medicine, they are mainly used to treat gram-negative infections, and in case of humans, they are also used as treating urinary tract infection, sexually transmitted disease, bacterial enteritis, pneumonia, rickettsia, and mycoplasma organisms. And in case of cattle, sheep, and goat, they used to treat Mycoplasma bovis and Pasteurella, E. coli, Salmonella enteritis, E. coli septicemia. And in case of swine, it is used to treat swine pneumonia, and in horse, they are not used in the young or growing horses. And in adult dog and cat, they used to treat urinary tract infection, respiratory tract infection, and also osteomyelitis. And this is about quinolones. They are generally narrow spectrum, and try to remember these two types of classification as first generation, second generation, nalidixic acid and oxalinic acid, examples for the first generation, and enrofloxacin and ciprofloxacin for the example of second generation quinolones. They act by binding or inhibiting the A site of the DNA gyrase. Thank you.